The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, today on Aging Horizons we've got a very special show and special guest for you. We were going to be talking with Dennis Nyland, who's the Montana Mental Health Ombudsman. You know, that's an advocate. That's a person or a organization who can help you kind of get through the system if you're having trouble, if you have someone that needs some assistance. Stay tuned with us. We've got a lot to tell you about.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare summary notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Receiving help for Ella has been life-changing, and the best word for it is relief. I was the therapist, I was the aide, and I couldn't be the mom because emotionally you're just to your wits' end, you're trying to survive.
I provide care for the Harrises, specifically their daughter Ella. Respite care is extremely challenging, but the rewards that you receive from it are 100 times more than working with a child that doesn't have special needs. Once they get something, it's everything. It's a you celebrate. You don't just enjoy those moments. You celebrate every moment that you get, that you guided them to that next step.
Respite. It's okay to need it. It's okay to want it. Will you provide it? Call 800-224-6034 or visit respite.mt.gov.
It went from survival to enjoying life and being able to be a mom again.
Brought to you by the Montana Broadcasters and this station.
Hello everyone and welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Kimmy Everman, and today we're going to be talking with, as I said at the top, very special guest, the Montana Mental Health Ombudsman, and that is Dennis Nyland. Dennis, thanks for being with us. Welcome.
Thank you very
much.
much.
So good to have you here.
Thanks.
I wonder if you would just sort of give a brief sort of bio about yourself and just tell us kind of, I don't think lots of folks know about the Mental Health Ombudsman in Montana, and we'd like to know kind of what that's all about.
Yeah, so I guess I'll real quickly with myself, born and raised in Montana in Helena. I was in the military once I got out of high school, was in the submarine warfare. So was around submarines in the Navy. Did that for almost 9 years. Came back to Montana, came back to Helena, and started, and before that, when I was still in the military, I was doing some firefighting, volunteer firefighting, thinking that was what I wanted to do for my career.
Once you separated, yeah.
Yep, and so I did some of that. I had already gotten my EMT, and came back, did some volunteer firefighting, did some jobs, and then I got into law enforcement. Was with the Lewis Clark County Sheriff's Office, was with them for 13 years, did everyone from all the way from patrol all the way up to, I was an investigator before I left.
Okay.
And during that time, we actually had, the sheriff at the time asked me if I'd be interested in this program called CIT, which was Crisis Intervention Team. It's a Memphis model. It has to do with giving law enforcement or teaching law enforcement how to deal with to de-escalate a crisis situation. So not only mental health was a big part of that,
right,
but any kind of situation. And then from that, I became a CIT coordinator. I got CIT going. We went to Memphis, a group of us, came back to Helena, decided, I think this would be something for the state. Went back, did train the trainer for CIT, came back and actually started CIT back in 2005. It was the first CIT class or academy. And so we've been doing it ever since.
And Dennis, are those teams all over the state or just in Helena?
So right now we have approximately 8 to 10 locations where we have academies. You want to teach the academy in the place where you're going to be at, because that's where the resources are.
Sure.
We used to, when we first started in 2005, 2006, that area time, we were doing it in Helena at the Law Enforcement Academy. But we determined you have to do it in the place where the resources are,
right,
and talk about those resources in that area. So now we have, major cities, or Valley County,
sure.
other places. So.
And can you also just give us a sort of a definition of ombudsman? Because, I think it's a fun word and a lot of people don't know what it means.
Yep, and I'm just going to kind of look at my note here. But
go ahead.
Basically, it's from Sweden, okay, 1809, I think. Basically, you had the Swedish Parliament. They appointed an ombudsman, which is basically, was there to resolve problems in the absence of the king. So now to come to where we're at now, it's more of a grievance handler. It's a people's representative. So basically, I tell people in a nutshell, I am the individual for mental health. I am the individual between the citizen and government. I'm that middle person.
Sure, that liaison.
Exactly right.
There you go.
Or advocate
sure.
For that person. So that's that, in a nutshell, that's what an ombudsman does, is to help resolve issues, try to help the individuals resolve an issue.
Right.
And then if you need to have the...
And if it's like the ombudsman out of the aging services, your client, if you will, is that person, right? It isn't the family. It isn't. You're working with that person to advocate for them.
That's exactly right. And to go back with that, I'm helping the person that has the mental illness or the mental issues going on.
Right.
But a lot of times what I'm having is I'm having family members that are calling me. They're trying to help their loved one that has some of those things going on.
Sure. And also, could you just give a short history of the office, of the Mental Health Ombudsman Office?
Yeah, so back in 1999, the state legislature came up with this program. It was actually called Managed Care Mental Health Ombudsman. That's because back in those 1999,
I'm trying to remember that. Yep.
To about 2003, it was Managed Care. After Managed Care kind of went to the side in Montana anyway, it just went to Mental Health Ombudsman.
Okay.
So it's been around for now, I think I just looked, it was like 23 years now. 22 or 23 years now that we've had it in the state.
And just describe the mission.
Yeah, so the mission is basically to represent individuals in the mental health system. So if you're looking for resources, if individuals need help with the mental health system, you can call my office. In statute, it says represent the interests of individuals with regard to the need of public mental health services, including individuals in transition from public to private or vice versa.
And what we'll do is run your number on the screen so that folks can have that, so that they can get a hold of you. But you really do like folks to give you a call, talk over whatever is going on. You may need an appointment, you may not.
Yeah, exactly right.
It's just a very individual.
Yes, they give me a call, they let me know that what's going on, and we'll work on hopefully a solution for them.
Yeah, that sounds great. And your advocacy is for all ages, or is it for seniors or anybody that's coming with a mental health issue?
Yeah, no, it's for anybody. It's from children all the way up to adults. One thing I just want to mention, when you have advocates, I am an advocate, but with that, I can't go to I can't do legal representation,
right, exactly.
Or I can't legal,
right.
But I can't, I'm there to help them advocate for themselves,
right.
Give them information.
There you go. I'm glad you put it that way, because that's exactly right, and empower that person to move forward if at all possible.
That's right.
Folks, we have so much more to talk about. The Mental Health Ombudsman for the state of Montana is an important resource. We're seeing more and more mental health issues in our country today, and we really need that resource. So stay with us. We've got a lot more to tell you.
I have a complete new respect for the Delta. Everyone is going to be exposed to the Delta. This is not the virus that we saw in the beginning of the pandemic. This is so much more dangerous, so much more communicable. People get sicker quicker. Now the question is do we want to have a barrier of protection, of antibody protection via the vaccine? Or do you want to just go at it by yourself? The hospitals are full of people that are unvaccinated, and they are just not full of people that have had the vaccine. The goal is to prevent people from getting hospitalized and dying, and that's exactly what the vaccine is doing.
In 20 years at an electric utility, I've seen the hardships many of our neighbors face with high winter heating bills.
Ross Holter, Flathead Electric Co-op.
That's why I donate to Energy Share of Montana. I just hate the thought of senior citizens, and young kids especially, being cold in the winter. Donate to Energy Share. Help your neighbor stay warm.
To donate, call 888-779-7589 or go to EnergyShareMT.com. Energy Share, you can help your neighbor stay warm.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
I was diagnosed with diabetes in 1992, and I went into denial. It made me angry. I was a professional chef, and I didn't want to change my eating style. It took me a long time to get serious about managing my health. My perspective changed from resentment to one of loving my body, the container for my spirit. Getting help from my diabetes educator supported my goals of improved self-care. I want to feel good and have a great life. My diabetes educator helps me do this.
Hi folks, welcome back to Aging Horizons. We're here with Dennis Nyland, who's the Montana Mental Health Ombudsman. We're so glad to have you, Dennis.
Thank you.
So let's talk a bit about your office. We call it the MHO office, Mental Health Ombudsman. What are some of the duties that happen in your office?
Yeah, so when people ask that question, it's a common question, what is a mental health ombudsman? Basically, I'm there if people are looking for an organization, for resources for an organization, or they're looking for a provider, or they're looking for a facility, mental health wise, then I can help them with that. Now, of course, if it's a provider or a facility and there's multiple ones in a certain area, I'm going to give them a list of those. I can't pick which one.
Sure, right.
So I want to make sure they have their choice of where they want to go.
Right.
So that's the resources piece of it. The big part, and where the ombudsman, as we talked about earlier, the ombudsman being that liaison,
right,
is I take phone calls. A lot of things. I get a lot of calls or correspondences from people, and basically, if they have an issue, a concern, or a complaint about something with the mental health system, they can call my office, and hopefully, I can be the one that can actually help them find that.
So let's talk a minute about that. What would be a concern or an issue that someone might call you about?
So I've had multiple things.
Sure,
one of them would be they are trying to get services. They've contacted their the facility or the provider, and they're not getting the services. Maybe case management, or they can't get a therapist. Big one is trying to get like a psychiatrist or psychologist.
I know in Helena that's difficult, and I'm not sure about the rest of the state, but I've heard it's difficult to find somebody in Helena right now.
Yeah, I mean, it was. I can't remember if this is, I think it's pretty close. There was a time where from Billings east, so the eastern part of the state, there was one psychiatrist for that part of the state. Now, there might be more than one now, but it's still pretty limited. One thing I will say about COVID, if you want to say anything that's come from good from that, is that we've actually have telemedicine or telehealth, and it's actually CMS, with
Medicare is allowing it and expanding it more and more.
And that's helped a lot. I mean, that's helped a lot to give people.
I'm glad to hear you say that, because I know that I was not a big fan to begin with, and then now I just would rather sit in front of my computer and do telemedicine with my doc or whoever than go anywhere. You feel safe, you're home, you're in a place that's familiar.
Of course, there's going to be
And there's
certain things that you have to do. You do still have to go see someone.
If you have a
in
broken
person.
leg, they can't do that over.
That's exactly right. And with mental health, you definitely have to you need to see someone to make sure that they, in person at a certain time period. But I mean, at least you can do therapy.
Get started and maybe make a connection.
Exactly right. That's exactly right.
Yeah.
Yep.
So So let's say that I call you and I say, I have this person in my family who I believe is in real trouble mental health wise. Okay. How do you handle a call like that? Take me through the steps.
Okay, so first thing I'm going to do is just find out who they are, what the information, where they're at, so I have a generalized idea where we're dealing with, so what part of the state, so I can look for my resources if we need to do that. Then I'm going to ask them what's going on. What have you tried? And I will be honest with you, there's a lot of times when I get people calling me, I'll say, do this, either get a hold of, if you try to get a hold of a therapist, if you try to get a hold of a mental health center in your area, whatever, go down the list. And a lot of times they've already done all that stuff. And I'm like the last resort that they're calling me. And quite honestly, we maybe fix a couple of things that they've tried, maybe give them a couple other ideas of how to do that. And then hopefully get them the help that they need.
Yeah.
If I need to, I can make some phone calls and let to facilities or providers and let them know who I've been talking with and see if we can help them out.
Sure.
So.
And so that person might say, because I know when I call for resources, I often will say, once I do this and this, can I loop back with you and make sure that it's going along the way it should? Is that something people can do?
Oh yeah, definitely. I mean, give me a call, let me know, yes, so I know if it's working. If it doesn't work, then I know to check that off on my list. That didn't work, that avenue isn't out there anymore, right. Or it doesn't work.
Right.
So.
And I want to be real clear with our audience. You're not coming to someone's house and taking them away. That's not how your job works, correct? You're just being in there as that liaison, that advocate, trying to make sure that the person who's got the illness is getting the help that they need.
That's exactly right.
And
yep.
We're trying to keep them out of the law enforcement system for sure,
yep.
And get them health care as opposed to any other sort of resources and such.
Yeah, it reminds me of like if you have a physical health issue, you call a nurse, or you can call a nurse and you can ask them about, hey, this is what's going on.
Right.
For the mental health, if there's something going on with mental health, you can call my office, get a hold of me. And I just want to say that I have a part-time person. Her name's Christina Ward. She is also the mental health service specialist, so she helps me in my office. So it's myself and her for the whole state of Montana. So yes, either one of us.
That's awesome. And you're there Monday through Friday.
Yes.
Yep. Business hours.
Yes.
Because it's not an emergency thing, but people can always sort of loop up with you if they need resources or just to talk.
Yeah, that's exactly right.
That sounds great.
Exactly.
Folks, the mental health system can be daunting and can be difficult for families to maneuver through. That person that they're trying to help may not want the help. So this might be a long kind of road to trudge up. So having someone like Dennis and his assistant Christine would be a way to maneuver through the system and get the help for that loved one that you need. And find yourself some resources as well, because it's not very easy being the person trying to get that other person help. So please stay with us. We have a whole lot more to talk about. Come on back.
With as many as 1 in 10 Americans at risk for Alzheimer's or some other form of dementia, chances are someone you know and love will receive that diagnosis. When that happens, you may well feel devastated, but know that you are not alone. Help is available. You don't have to face dementia by yourself. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
It's been 27 years. I never thought I'd still be smoking, but here I am, COPD and all. I'm about to have a granddaughter. There's so much to show her, but I'm scared I won't be able to keep up like I used to. I kind of gave up on myself on quitting. But it's different now. I want to be here for her and for my daughter.
When I stopped showing up, Jim showed up at my door. He took me to the hospital in town to get me help. That's the day Jim saved my life.
Everyone has a role to play in preventing suicide. Know the signs and don't be afraid to speak up. If someone you know is in crisis or emotional distress, the only wrong thing to say is nothing at all. Call 800-273-TALK or text MT to 741-741.
Every generation produces heroes, men and women who step forward to defend our country in time of need, no matter the personal cost to themselves. And though we can never fully repay them, we can make sure they have access to low-cost, long-term care when they need it. That's what Montana's Veterans Homes are all about. If you've got a hero in need in your family, call us. We can help.
Hi everyone, welcome back to Aging Horizons. We're here with Dennis Nyland today, the Montana Mental Health Ombudsman. Dennis, welcome.
Thank you.
Let's talk about some statistics. That's always interesting, I think, and especially in Montana where we know suicide rates are high, mental health issues may be hidden all over the place, and not a lot of resources. So let's hear about what's out there right now.
Yeah, so I can tell you just from the latest stats that I have for my office, last year we had 592 calls during the year. So that equates also almost 600 calls. Just to give you some idea, I started this job in 2014, November, so 2015. In 2015, it was 375 calls a year. And then the next year was 435 calls. And we had a little lull, about 408 calls the following year. And then in, I think it was 2019, we actually had 491 calls. So almost, we've been going about 15 to 18% increase every year.
Yeah.
I think it's a combination of us getting our name out there so people know that we're there, but also I think we're dealing with mental health issues in the United States, in our state, and I think people are using it, and that's what I want.
Good, yeah, exactly. And you know, I guess if you want to make a comment on how has COVID been treating your office, has that caused lots of mental health issues for you?
You know, I thought it was going to be, yes, I've been getting calls about COVID and
just the stress of it, or the the anxiety of it. Yeah,
I'm preparing myself, and our office is preparing ourselves for when this kind of lays itself down. That we're going to be getting people that are going to realize, man, I just went through a crisis time the last couple of years, and they're going to realize, how did I do that? And then they're going to, hopefully, they're going to have the support system to help them with that. But I'm waiting to see that people are going to realize, man, what just happened, and now I need to talk to someone about what just happened the last 2 years. So,
well, okay, so that brings me to this. How do we get a hold of your office?
So there's a couple ways you can do it.
Okay.
You can get my phone number.
Sure.
And I think all these things I'm going to be telling you, it's going to be on the screen.
Yep, we're going to put it on the screen.
So you can get a hold of us by phone number. You can get a hold of us by email. We do have a website that you can go out there, just go Montana Mental Health Ombudsman, and it'll come up on your screen, and you click on there. It gives you all information about our office. The resources are also on there. And then we also have a Facebook. My assistant, she works on that quite a bit, and so there's a Facebook that, and how it's set up is that you can ask questions. It doesn't get broadcasted out.
Right.
We have it set up in this so that it doesn't.
So it's a private. Yeah.
Yep. And we want it that way. We want to hear. And if there's something that needs to go out, then we'll put it out.
Sure. That sounds wonderful, and I'm going to check that out.
Yeah, it's good. It's good.
Now, also, you've got some projects that are going on, or that you're in the beginning stages of. Can we talk about that a little bit?
Sure. There's a couple that I just real briefly was going to bring up during this time. We did a couple years ago. We started working on crisis mobile units. So basically having a unit, a mental health professional, and like a peer support or support staff, could be an EMS, it could be peer support specialist, going to where the person's at. So if a law enforcement gets a call, they can call the crisis mobile unit, they can come and they can actually work on get them the help that they need either there, or if they need to go to the hospital or go to a facility,
right.
They can work on that aspect of it. Right. So we worked on that. I don't know if you've heard of Mayor's Challenge.
No.
Basically,
tell us about that.
Yeah. So SAMHSA, which is the Substance Abuse Mental Health Services Administration, they have a program for service members, veterans, and their families. It's called basically SMVF. And they actually had some grants. And so a few years back, we actually got some of those grants, and we used that for the crisis mobile units.
Right.
We actually got into legislation. 2019, it went into the legislature, and they created crisis mobile units and gave us some funding for that for the state, which was great.
That's great news.
And then the same organization, it's called Safer Communities Montana.
Mm-hmm.
So basically what that is, it's advocating for suicide through collaboration with firearm and pharmaceutical communities. To reduce access with people that are at risk. So basically, suicide prevention by talking about lethal means.
Yeah.
Lethal means we're educating the community, but we're also talking to firearm dealers, firearm ranges. We're talking to pharmacists that see these people that possibly are at risk for suicide, and they can and we actually give some education to them also to be watching for signs and symptoms so that they can help those individuals.
What a great idea.
So we've been working on
it's really one of those hidden things sometimes.
Yes.
It can be really hard to see and to deal with. So.
It is. And
Well, and I was going to say, Dennis, we just got about a minute or so. What else would you like to tell us about your office or your job that you really want our audience to be aware?
Just that if you are dealing with a mental health issue, or if you feel like you're in crisis, of course, we're not the law enforcement. We're not the mental health professionals that can help you and actually go and give you the help that you need.
Physically, right.
Or get you to the place you need to go. But if you're having some questions or issues, you can call my office, and we will be very happy to help you.
So you're kind of information central on this.
That's exactly right. Yep.
And you can, I always say it's kind of directing traffic in a way, because we may not give that service ourselves, but we can hook somebody up to that service or tell them all about it.
That's exactly
right. Well, it's been just great having you, Dennis. I'm so happy that you're still with that office, because it's so important. And I think what you said about we've just been through a couple of years of crisis is true, and we really, really need this kind of a resource out there. So I'm so glad that you're hanging in there and doing such a great job.
Well, thank you.
And folks, again, this is not, you shouldn't feel guilty. There's no, we shouldn't have stigma. If you have a mental health issue, it's no different than having high blood pressure. You just want to get some help and make sure that your life's a good one. Thanks so much for being with us, and be safe out there.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.